Call the office at 572-0383 or 572-0215. REV-UP St. Lucia, the alpha of radio.
Join Dr. Leonard Surage on REV-UP St. Lucia Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House. This 1-hour discussion call-in program delves into the science of various diseases, treatments and medical processes, and offers in-depth explanations to empower listeners and help ensure a better understanding of healthcare for all. So tune in on Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House with Dr. Leonard Surage, only on REV-UP St. Lucia. Doctor in the House, brought to you the compliments of Dalkin Pharmacy, also with the compliments of La Place Salaison and Tapio Hospital.
At Tapio Hospital, caring and competent obstetric consultants who will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapio Hospital, where the patient safety comes first.
Looking for affordable, reliable healthcare? Visit Dalkin Pharmacy on Coral Street, Castries, where your health comes first. We carry a wide range of over-the-counter and prescription medications, all at unbeatable prices. Plus, enjoy special discounts on prescriptions for kids 12 and under and seniors 60 and over. We offer supplements, body braces, skin care, feminine care, and oral care items, topical creams, and more. Plus blood sugar monitors for just 40 EC, 50 test strips for only 50 EC, and blood pressure machines at affordable prices. If what you need is currently out of stock, we're happy to place specialized orders just for you. Need advice? Check out our private counseling room. Visit Dalkin Pharmacy on Coral Street, Castries, opposite the Magistrate Court, or contact 572-5282 or 720-1655 for more information. Dalkin Pharmacy, your health is our mission.
It's delicious.
La Place Salaison is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salaison, of course. La Place Salaison, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
It's time once again to bring you live on REV-UP St. Lucia, Doctor in the House, hosted by Dr. Leonard Surage. Dr. Surage, a very good evening to you.
Good evening, Andre. Good evening, listeners, and nice to be here again. Today, Tuesday, 3rd of March, 2026. You're listening to Doctor in the House, and today I had a few patients whom I had seen during the course of the week, and that prompted me to give a little more attention to one particular illness, and that is problem of the voice box, the larynx, what we call the larynx, but that is the anatomical name for it, but generally we call it the voice box. There can be many things that can go wrong with the voice box, and people tend to leave it for chance. They tend to come late. And I also want to talk a little bit about the role of the virus that can cause problem with the voice box, what we call the human papilloma virus. I'm not going to be exhaustive on that one, but certainly I will mention it in respect to the voice box itself. So basically, what is the voice box? I'm sure you've heard of the Adam's apple. Mm-hmm. The Adam's apple is that little notch that sticks out. Well, that is where the front part of the voice cord is attached. There are two voice cords, left and right. They're like thick bands that can stretch and get tighter. It's just like a guitar string. You can make it loose or tight, and you can, in the voice box, you can widen it or narrow it down. So the voice box is located in the inside part of that Adam's apple. In the medical language is the larynx, and the pharynx being above it, and what we know it as is your voice box. It's about 2 inches long. It's a tube in the neck, and it is also where your breathing takes place. The narrowest part of the entire breathing mechanism, from the lungs to the windpipe and everything, is where the voice cord is. The voice cord is like the gatekeeper at the very top of the breathing tube, and that voice cord, 2 of them, and they meet together called adduction, and they open apart called abduction, and there's a muscle to which they attach can actually tighten it or loosen it, and that's how you develop all your range of your register, your range of ability to be able to sing, to vocalize, etc. So that's your larynx. So basically, from what I'm saying so far, you can appreciate that your voice box does 2 things. It controls breathing, it makes you speak. And it's also involved in eating because it shuts down when you're about to swallow. And the swallowing tube is just behind that voice box, and the food goes through the back and passed down into the stomach. So as I said, you speak and breathe and eat with using this particular voice box. When we talk about cancers or any other thing that affect your voice, we are talking about things that prevent the voice from working. For example, the voice cord can have inflammation from a cold, from a this and a that, or it can have a growth on it. In fact, I saw somebody with a very small blood vessel growing on the voice cord. But the person is hoarse, but the hoarseness may not be coming from that. There must be an associated problem with acid reflux, but that is down the line. So that's the anatomy of the voice box. It's located there, and that's how when they are going to strangle you, or when you're going to be hanged, that the rope is tied in such a way it actually cuts the airway. But most people die not from the airway, but from the neck that's broken. And so, but the airway do strangulate you. And as you know, if you have no breathing for 3 minutes, you begin to get brain damage. 3 minutes, that's all you're allowed. So, basically is the larynx only about a smoker's disease? The reality is that while smoking can be the cause, it's not the only cause of getting problem with your larynx. If you look at the larynx, above it would have been your tonsil, your throat, etc. And bacteria from the tonsil can get on the larynx, you can get a laryngitis. Anytime you hear the word itis, it's an inflammation. Bronchitis, inflammation of the bronchus, appendicitis, appendix inflammation. So all the itis are inflammation. So when you get a bronchitis, it can be either from the tonsil getting infected, spill bacteria on the voice cord, or it can be, and the bronchitis is inflammation of the bronchus. And it can be inflammation from the stomach, from the lungs itself, the spongy lungs that gets infected and throw bacteria up in the voice cord. So either way you get it. And also thirdly, you can get reflux. So you, for some reason, the lower end of the swallowing tube is loose, and stomach content, especially acid, flow back up when you're in a lying position. And some people have the bad habit of eating and belching it back and eat it and bring it down again. That can create more acid issue for you. And so these things are extremely important.
What did you say they do, Dr. Surage?
They would eat, and they would bring the food back up by regurgitating.
You mean doing that deliberately?
Yeah. As a habit, sometimes maybe they ate too fast and the chunk of food is too big, so they bring it back up, chew it again and bring it back down.
Wow.
So that happened. But let us look at inflammation of the voice box. So that can happen from the sources I mentioned. Bacteria from elsewhere, people who have cold, etc. If your immune system is weak or if you are exposed. And I think lately I've been seeing a lot of people coming from the plane having a cold. They may not have had it before they went in the plane. So I'm not too sure if post-COVID there's a lot more infection hanging around the plane that causes that. Something that perhaps they need to do some investigation on. But I'm seeing many people who have traveled and have a residual cold afterwards that settles down. So you can get a cold from that. And also you can get a cold from any of a laryngeal infection from any of the types of organism. An organism is a small or a big creature that has its own metabolic pathway that can stand alone. That's an organism. It doesn't rely on anything. It can live on its own. And there are many types of organisms, small and big, that causes infection. They can be bacteria, which is a bigger one, and there are different subsets of bacteria. They are gram-negative, gram-positive, and lots of different names. That's bacteria. There is fungus, which grows slower, and fungus are everywhere. It's called champignon. And other types of, even like when you have thrush infection, children, low immune system, when the children are small, they have this thrush infection in the mouth, and that's a fungus, and that happens often. And some women, even when they take antibiotics, it kills the bacteria because there is a symbiotic, which means there is a good relationship between the bacteria and the fungus that reside in the vaginal tissue. They live there happily, perfectly at peace with each other, no problem, no symptoms. Then the lady takes antibiotics and it kills the bacteria and the fungus overgrow. And the overgrown fungus begin to cause an itch because of discharge, may cause other things, and then they have that problem. And of course there would be no other reason why they would have it. Usually the antibiotics cause it, so you treat that with antifungal medication and that usually settles that. So we have causes of infection: bacteria, fungus, virus. Virus is the smallest of the three, and of course far more is prolific in multiplying and move fast. That's why you have the common cold. You cannot get a cure for it because there are so many different modifications of it. It mutates so fast that by the time you develop a vaccine for it, it changes. So you have to, every year, a new set comes in, so you have to treat it as is. And so you can get infection from that. Of course, from still on the larynx, still on the voice box.
Just sorry to disturb you, Dr. Surage.
We're here to talk.
Yes, yes. Is it a myth that when you catch a cold, you just explained how the virus operates.
Yeah.
It doesn't remain static. It mutates. It changes, right? So when people talk about taking, for example, bush medicine to cure the cold, is that a hoax?
Okay. Unlikely that the bush medicine would have ingredients that specifically attack the virus. Unlikely. It is more likely that the bush medicine will provide the body with fluid and other things that will help the body to defend itself. And in so doing, the bush medicine may, because the body itself take care of itself. The body, the white cell, the the lymphatic system, the red cell, white cells, and the lymphocytes, and these things are the army inside your blood that fights everything. So when you think is a medication or two that does that, then it really is the body that heals itself. Because the body is a fantastic healer. All we do in most of the time is to prevent anything that will delay or stall the healing process.
So,
for example,
is that what the bush medicine does?
The bush medicine just maybe none of those, but some of them may have anti-inflammatory properties. Locally, you may decide you're going to put a few drops on the skin or whatever. Maybe you have a sprain, it might reduce the swelling. These are not things that are scientifically proven, it just happen. But there will always be a role for it, because it allows the body to heal itself. It may do nothing, but it can give you a sense of well-being as well, that something is being done. And in the same way, faith can heal a lot of things. If you have faith in the medicine, then it may work for you, because you say to yourself, well, I have applied the medication, let it work, and it will work. So your body takes care of it. You're not sure which one that take care, but you get better.
So you're saying if you believe, then it helps.
If you believe, it helps. Faith has a way of helping with your immune system, and they tell you people who are strong in their faith tend to weather storms, because the peace and tranquility of their mind assists their immune system.
So, Dr. Surage, so people now who are about to have surgery, and they're heavily sedated, they don't know what's going on.
No.
So they don't stand, they barely stand a chance, because you don't know what's going on. You cannot even express that faith that you're talking about at that particular moment.
No, but that faith is not on the day you go in for surgery. Eh?
So you have it before?
Before and after. because what it does is the peace of mind that's important. And people who have a positive frame of mind. There are some people that see doom and gloom in everything. They see the negative. They criticize everything. They have no answers for anything. But they always seeing something not good. They offer nothing. They offer no solution, and they do not invest in any solution. But these people tend not to have an immune system as strong as those who feel happy. They have a clear mind. They have faith in their God, etc. So the studies are pointing towards the immune system intimately linked, not all the immune system. In other words, that if you have faith alone and you do everything else wrong, then don't expect the faith to cure you. But generally speaking, if you have a healthy mind, strong, good will, and you have positive outlook, then your immune system is better.
Okay, so that's the bush medicine. You're saying, and interesting coming from a learned doctor, that it begins with your mind, that you believe that this bush medicine can help you. So that's a definite positive. Okay, that's better than saying, "Oh, it won't work," that sort of thing.
That's right.
Right. So that's a good place to start. All right. So now let's put the bush medicine aside. Let's talk about over the counter. So I feel like sniff. I have a sore throat, things like that. All the symptoms that I'll be catching the flu or something. All right. And I go to the pharmacy and I pick up some over the counter medication, right, to ease the symptoms. Does the same principle apply? That I believe that this thing I bought right over the counter is going to some way somehow ease my symptoms.
Yeah, but
does the same principle apply?
It applies to a large extent, in the sense that, say, if you have stuffy nose, you're getting a cold, you sound nasal, a bit of a coughing, blocked nose, and you take over-the-counter medication to spray your nose, to free up your nose. Your nose breathing better makes you feel better. it may have done nothing medicinal to you, but you're breathing better, it relieves some of your symptoms. If it had no other effect, the fact that it gives you're now more comfortable, the body will heal the rest.
I understand that, Dr. Surage. And you did a very good job in explaining the use of the natural remedies, right?
Yeah.
Okay. You believe this is going to help you. Because from what you're saying, when you catch the common cold or the flu, it is difficult to keep track of it and to properly or successfully address it because it mutates.
Yeah.
So that's why it's almost impossible to get a cure.
The same one that attack you today, next 2 months
it'll be something else. So it's very, very difficult, if not impossible, at least for the foreseeable future. So what we have left now is faith, from what you're saying, and the faith has to be applied in the. Well, sorry. You believe that faith does help with the reduction of symptoms and so on, if using some natural remedy. Okay, right? I think we'll accept that. So I'm saying to you, if now I say I'm not interested now in the bush medicine, I'm not interested in that. I have faith that if I go to the pharmacy, I'll have better luck there. Whatever it is I pick up,
okay,
right? Panadol or this, that, and whatever you decide to pick up at that point in time, you believe that this is the road for you to go to get relief from your symptoms. I'm just asking if the same principle applies, that it's because I believe in it, or is it the Panadol I'm taking that has something in there, right? Which can definitely ease the symptoms.
Right.
And the same thing should apply, if you say yes, Dr. Surage, the same thing should apply for the natural, the herbs.
But one other thing that, now that you've explained it in the manner in which you have, it's clearer in my head now. What you have there is that you go to the pharmacy and they would give you a non-prescribed drug over the counter. Over-the-counter medication does not mean it's not medication. All it means is that you don't need a doctor's authorization to be able to purchase it.
Right.
It may be because it is a dangerous drug. Maybe it is something that can get you habitually inclined and therefore would prevent that, and for many other reasons. But the medication you buy in the pharmacy, if it says this is to clear up your nose, chances are it does it because it's a medicated thing that has been tried and tested to do just that.
So is there, however, in the case of the bush medicine, it hasn't been tested and tried?
It has been. There is personal anecdotes about it. Oh, I take it made me do good.
Right.
And most time they cannot say, you cannot hear them saying, well, I take kossol leaves, which is soursop, to reduce my pressure. When I take 2 leaves, the pressure was lower. When I take 4 leaves, the pressure was even lower. When I took 1 leaf, the pressure was high. Nobody come with you with that. Or they say, take it, man, take it. Oh, I feel better, my pressure is good, without measuring. So that is where, even though it is over-the-counter medicine, but most of them have been derived by some scientific analysis. Just that it is considered safe enough to be sold.
And the proponents of the bush medicine will say that the bush medicine has those properties, right, that can heal. But you're saying that has not been scientifically proven. It's just going on, as you said, maybe my grandmother took it, or a friend told me it helps them, that sort of thing. So you say there's no concrete evidence that the bush medicine in that particular situation was the thing that did the job. It was just more maybe faith, if I understand you correctly.
Well, for example, when you look at, say, marijuana, there have been studies that show it do certain beneficial things. For example, they say even people with cancers, it assists them, they don't feel so bad, they don't feel so unwell during treatment and things. So there are studies that have put bush medicine in some kind of legitimate right, and so it is used, but not all the time that you have the scientific proof. And also, there is science and science. Like everything else, if the design of the research, we're getting into very detailed area, the design of the research was such that it was not rigorous enough to be able to prove certain things. And it is done in a very superficial manner and come to a conclusion. Some of the bush medicine people will use that and tell you, oh, but there is research that say it can do this. But some of the research have not been able to stand the test of scrutiny and international acceptance in terms of quality of research.
So, test of scrutiny, you mean, for example, say I, from my experience, I know this particular leaf helped my grandmother when she had a cold, or my grandfather, or maybe my brother and sister. You saying that's not sufficient evidence to prove that this thing is actually able to do what it says.
No,
sorry, what you believe.
Yeah, because, okay, for example, many people have died from a massive stroke because of high blood pressure they had for years and didn't know. So when we say high blood pressure does not give you headache, it doesn't give you pain. And so how can you tell me something didn't work? Something worked when you have no way of saying what it did. All you go by is your feel. Your feel is a very subjective emotion. And you can, and for example, I can remove the tonsil of one person and move the tonsil of the next person, and they behave totally different. Same operation. One would be sitting in bed, would not want to stand up, don't want to take water. You have to give them medicine by the vein. The other one, tomorrow they are at Kentucky, they want to eat food. Same procedure. Most of the time, it is your pain threshold and fear. Fear has a lot to do with your perception of pain. And that is why you can kill a goat or a sheep and they don't bat, because they don't feel, they don't have as much fear. And so you find that they do not struggle the way a human being will struggle if you're going to kill you. So the concept of pain can give you an idea of the subjectivity of that, because, yeah.
I want you to address another area related to what we're talking about. The people who believe in the bush medicine will say, this is the same plant that the scientists use to put their concoction together, and we have to pay for it and pay a lot of money for it. It's the same thing. Isn't that correct?
Well, they would say that, but I'm not too sure to what extent that's true, because I understood there is a Panadol bush. I used to grow it. I never tried it though. It grows very easy to grow.
I've heard that, yes.
Yeah. And so I'm not too sure if Panadol was actually made from that, but you hear it around. And you hear lots of other things. And also we know a few things that have been tested. For example, the soursop leaves, the young leaves, do have, it makes the children, when you make tea out of it, it makes the children asleep.
Yes.
And we know now it has some amount of barbiturate that is a soothing thing on the brain and make them sleep.
And on that note, Dr. Surage, we go back again to these things probably not being tested and so on. How do we as parents, the parents who do that, who give the children those things to cause them to sleep and so on, how do we know if we're not even causing an overdose?
Well, we don't know.
Where the child is concerned.
Yeah, but we know from tradition that 2 leaves or 3 leaves or the buds, called the bourgeon, that 2 or 3 buds, put it in the water, drink it. So these things usually have a fairly large safety margin on it. But when you compound it and say you extract it to the real stuff, then you use less. But you cannot know how much it really has in it. You have to do scientific testing. I remember once they had asked me to do a research on, they said there's a plant that anytime the cows eat the plant, they abort.
I remember you mentioned that.
And they ask, how would you know what in the plant that does it? So you have to test the leaves separate the root separate, the stem separate, and see what is it that, and extract a different chemical to see what is it that is actually making that has such an adverse effect on a rapidly dividing cell. And so that is what the research is. You have to identify the thing. There's a method, an analysis you carry out to find out what part of the plant, how much of it, and when you identify what it is, how much is contained in a leaf, how much is contained in a plant, how much is contained per milligram, whatever. So that is the way you move forward. It's just, I don't think it is that doctors are adverse to plants and anything that is, they are adverse to the uncertainty and the unpredictability of what it is. And if you can put it into scientific term and tell them, well, 2 leaves of that will drop my blood pressure by X, and you can prove that, then they'll use it.
So how does, before we take the break, so I guess the average person cannot prove something like that because there's not an extensive study. It's just maybe you going through your experience or the experience of your parents.
But there are a lot of research that have been carried out by different authorities, and they have claimed and disclaimed a lot of things that were thought to cause certain beneficial result, and it really doesn't. And there are some other things that can cause adverse effects, etc.
So in the case of the animal aborting, what was the problem?
That is how they developed the cancer drug, vincristine and vinblastine, because these plants had that amount of chemical in them that when taken in a certain amount will stop cells from multiplying fast, because a cancer is a fast growing cell that is out of control. It's not growing and stop growing, it's keep on growing. And so any medication that is going to stop fast growing cells will work for cancer. And the fastest growing cell is a fetus. Grow fast. In 9 months it comes from two eggs that form a human being of all different parts. So you can see how fast it grows. And so that growth, if you can get something that slows down, and that is how many antibiotics work. The antibiotics work by killing the bacteria when they're multiplying. And that is why fungus take a longer treatment than bacteria, because the fungus grows slower. If you're going to kill them when they're having their cycle, then when they grow slowly, it takes longer to kill them.
Okay, Dr. Surage, when we come back, we'll take calls.
Yep.
Yes. So this is Doctor in the House live on REV-UP St. Lucia 95.9 FM with Dr. Leonard Surage. The program is brought to you with the compliments of Dalcan Pharmacy, La Place Salazon, and Tapio Hospital.
Tapio Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapio Hospital, where the patient's safety comes first.
It's delicious.
La Place Salazon is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazon, of course. La Place Salazon, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Looking for affordable, reliable healthcare? Visit Dalcan Pharmacy on Coral Street, Castries, where your health comes first. We carry a wide range of over-the-counter and prescription medications, all at unbeatable prices. Plus, enjoy special discounts on prescriptions for kids 12 and under and seniors 60 and over. We offer supplements, body braces, skin care, feminine care, and oral care items, topical creams, and more. Plus blood sugar monitors for just 40 EC, 50 test strips for only 50 EC, and blood pressure machines at affordable prices. If what you need is currently out of stock, we're happy to place specialized orders just for you. Need advice? Check out our private counseling room. Visit Dalkan Pharmacy on Coral Street, Castries, opposite the Magistrate Court, or contact 572-5282 or 720-1655 for more information. Dalkan Pharmacy, your health is our mission.
Welcome back to Doctor in the House live on REV-UP St. Lucia with Dr. Leonard Surage. Dr. Surage, it's back to you.
Thank you once again, Andre, and listeners, thank you for staying on. At this point, I would invite you, if you care to give us a call, and if you have any question to ask, or if you have to make any contribution to that topic. Remember, it's a two-way street, so we would appreciate if you have any comments to make. The number to call on the fixed line is 572-9710, or the WhatsApp at 287-0971. So let's continue. I wanted to say a few things about cancer of the voice box. How the reality is that smoking is still a big issue. Not only cigarette smoking, other smoking does have their own risks of cancer. So, for example, people who have cancer of the throat or the voice box, usually, to a large extent, some of them may be smoking or alcohol. Smoking and alcohol can increase your chances of getting a cancer in your throat because it affects the immune system, and the smoking has particles that that is in the smoke that are carcinogenic and likely to give you cancer. The other set of stuff that can give you cancer is the human papillomavirus. Now, I will say a few words about the papillomavirus. There are about 200 types of human papillomavirus, of which not all have the potential to form cancer, maybe about 2 or 3 of them. The HPV 16 and 18, that's a name, the brand name, are more likely to be involved in cancer. And of course, you can get cancer from silent acid reflux over a long period of time. It doesn't give you much pain, but the reflux is there. And the acid is irritating the lower end of the esophagus all the time. Chronic irritation can give rise to cancer.
Okay, Dr. Surage, stick a pin right there.
Yep.
Okay, let's talk about the human papillomavirus. We need to be educated on this virus because from our understanding, this is the virus that causes a cancer of the uterus?
Yep. Cancer of the cervix.
Of the cervix.
The neck of the womb, they call it.
Okay, so it's not the complete.
No, not the whole thing.
Okay, but of course, I guess it can spread, right?
Yeah.
Over a period of time. Okay. Okay, let's take the call first, and then I'll get back to that. Okay, we have somebody on the line.
Hello.
Good evening, Andre. Good evening, Doc.
Good evening, sir.
Good evening to you.
Yeah. How are you?
I'm good.
Okay.
Good enough.
Thanks for accepting my call.
No problem.
Welcome.
So,
Doc,
what do you have to
about-
share with us today?
We're talking about the larynx, better known as the voice box.
That's right.
Okay. And the gullet is the same as the esophagus.
You're right. Man, you got it well. Esophagus, they call the gullet. I wouldn't forget the gullet. Okay.
Okay. Doc, it's normal that when we eat or swallow something, it goes to the stomach. Huh?
Yeah. Through the gullet.
Now, if you have through the gullet. Now, if you have a problem with your larynx and the antibiotic or whatever goes through your gullet and in your stomach, how it reach the larynx?
Oh,
The medication.
okay. if anything,
And
yeah.
okay.
Go ahead. And
Yeah, that's one.
uh-huh.
Okay. Then the other one, Doc, we're not knocking down anybody who sells this bush medicine.
Mhm.
But when somebody's selling those bush medicine, don't they have if you decide a bottle to drink, they tell you it's good for the prostate, for the kidney, or whatever, don't these people have a right to tell you what's in this bottle? Because when you go in the pharmacy, you see the ingredients on certain medication. Don't these people have a right to tell you what they sell for you in the bottle?
Mhm. They should, but our law.
Or is there anybody like the Ministry of Health or whatever to pass to check those people who are selling those things, to ask them what are you selling there? What in the bottle there? What content you have in this there? Because if you buy this medication from those people who are selling this bush medicine, and you get any effect or any other sickness, you cannot go back to them and tell them, because of what you sell from, what you sold me there, it got me sick. You can't do that. So is there anything we're not knocking down anybody, but just to let those people who sell those bush medicine to be on strong footing. What you have in the bottle there? How many soursop leaf? How many root of that? You understand?
Yeah.
So that is my thing, and about the medication that goes through your stomach, how it will change your larynx. I don't know how this thing
So
works.
let me deal with that one for you.
Good observation, Caller.
I
Very
must
good
say
observation.
that you're very
I'll listen on the radio.
intuitive.
Okay.
You're very intuitive, and you ask very provoking question and relevant in our society. I will do the first question first because it's easy to kind of deal with it. When you swallow, the food supposed to slide in the back of your tongue, from your mouth, in the back of your tongue. In the back of the tongue has a flap called the epiglottis. When the food is going, it closes that flap, which actually closes the voice box, and the food just goes in the gullet. So like the gullet and the voice box are next to each other, but when you swallow, a flap covers the voice box and direct the food towards your gullet, and it goes down. Now, if sometimes you are talking and swallowing, or you've been disturbed, the food can go the wrong way, especially if you're drinking water. And they say it goes in your gosier, maybe because your eyes water after a while. But that is when something goes into the windpipe and not the stomach. So the body have its own mechanism where it direct everything towards the gullet and covering the opening of the windpipe. So that takes care of that. That should be fairly straightforward. The other one, I think it resides with the pharmacy, with the pharmacy council, Ministry of Health, and the Allied Council. There's a medical council in St. Lucia and an Allied Health Council. The medical council deals with matters of medicine and doctors and people who have medical degrees. And all the other things like pharmacy, radiology, and nursing. Well, nursing have their own council. And other allied health services, and including the medicine as it pertains to herbal medicine. All these are. It is the council that deals with herbal medicine that has to take that issue, because the job of the council is to protect the citizen. Both medical council and the allied council is to protect the users of the service against the practitioners. So that matter, it's a very important matter that you raised, and it resides, and it is solely reside in that they've been given the authority according to the act to be able to make decisions on that and keep us safe. I think the main reason nobody complains. And you cannot pursue any wrongdoing or any queries unless somebody complains that I took this, it didn't do me well, I want to know what you're doing about it.
And don't forget the point you made earlier, the faith issue. Because most people will never believe if they bought something that is being advertised as natural or being promoted as natural, that it will do them any sort of harm. So
That's right.
I don't think we'll get any complaints there. And plus, Dr. Surage, if the say authorities have to step in, right, they're going to have to institute some serious penalties, right? That's the only way. Because remember, you have these individuals who sell those things all over the place.
Yeah.
So how do you
I
police something like that?
Right. I think policing it is the issue. They may very well know that something is happening. They may well know that some people have gotten the bad end of the stick from time to time, but it is how to police it, especially in a society
Yes.
that is so bent on
Towards
bush medicine.
Exactly,
Yeah.
exactly. So even if people are feeling sick, they would never attribute their issue with the natural, because we just see the natural as natural, no side effects. That's just how it is. And it's amazing when they're selling those things, they say it out loud, They say it out loud.
Yeah.
That's exactly what it is that they're selling.
Because they have this thing, the bacontour thing. Nobody knows what's inside of that. A whole set of leaves, roots of this, roots of that. I don't even think the people sell. And it will give you all kind of benefits. It will improve your manhood, your powers, your everything.
Yes. Mm-hmm.
And so.
And there's so many of these concoctions, Dr. Surage. There's so many of them, right? You look into the bottle, you see roots, all kinds of things in that.
and like everything else, whether you're looking at squatting, whether you're looking at illegal parking by the road, whatever you look at, if you don't cut it, if you don't stop it at the bud, you'll have a problem you can never control.
Well, maybe that's what's happening. So, Dr. Surage, with the little time, I want to thank the caller for bringing up those questions.
Very good. It's a very good observation.
Definitely.
Yeah.
Okay, so the human papilloma virus, which is wreaking havoc in this country. I just want to know, Dr. Surage, can men be affected by this in any way?
Oh, yeah. In fact, as a matter of fact...
Before you answer, you have another call. Okay. So hold your thought.
Yeah,
okay.
All right.
Hello, good evening.
Hello, good evening.
Good evening, madam. How are you?
I'm okay, thank you.
Okay, thank
Great
you for
program
calling.
as usual.
Okay, thank you.
I have a 4-year-old son. I always give him, I give him the leaves to drink, like the godite, the tree of life, the coastal leaf. Is it safe to give it to him? Because he really likes it.
Oh. I know what the coastal leaf has in it. It has a little sedative in it. Not enough to actually get you drowsy, but it make you feel sleepy.
I'm sorry to disturb. So what's the leaf of life? Is that what she said?
Yeah.
So what is that one?
I don't know. I've seen the godite one. It's a prickly thing. Godite.
Is that what it is, caller?
No.
It's another one. You can put it in your book and it grows as well. I don't know. That's what they tell me.
You can put it in a book and it grows?
Yes.
Wow. Amazing.
And it's called what? Life?
Leaf of life.
Tree of life.
Oh, tree of life. Oh, sorry.
That's what I know it as. I don't know if it has another name.
Well, I do not know much about the tree of life. The godite, I know it is.
I'll have to send a photo for you, Andrew.
Yes, I think so. I'd love to see that. Yes.
Okay.
Yeah. Let me see if I can get some for myself.
So what is I have heard about the godite. I don't know what it does, but
okay, caller. Thank you.
Okay, thank you very much.
Good night.
Yeah, so I really don't know what the godite does. I know what the coastal leaf. I have an idea, but I have not seen any research on the coastal leaf. And I think we should be doing more research on these. If we really want to get to the bottom of these things, do some research. And I don't expect the average person who's peddling this thing will do research.
Yeah.
But funding can be developed or made available to look at the medications we have, what we use, especially things like the turmeric, to what extent it can thin the blood. And we also heard that that the cinnamon can thin the blood as well, and the ginger. So when you take turmeric, ginger, and cinnamon, how does it? And you're taking your aspirin 81 milligrams, to thin your blood. How all these things impact? We need to know these things.
And I mean, Dr. Surage, when I read about how these clinical trials are being conducted, these are very expensive endeavors.
Yeah.
I mean, you're talking about, I remember, was it COVID? I mean, there were like thousands of people who were being given those, what's it called again? The NRA, I don't remember exactly.
Oh, yeah, I know.
Right? The vaccine, okay? I mean, so that costs a lot of money. And we in the Caribbean, we don't have those kinds of resources to be paying scores and scores of people, because as you said a while ago, these things are done in such a way that you have so many people involved, so the likelihood now of it being effective is sort of greater in a sense, because the results now would show among maybe 1,000 people will report the same thing. When I took it, my so-and-so cured. Vis-a-vis somebody who just stays and says, okay, I have I saw 20 patients today, and among the 20 they reported the same thing. And if I can just remind you of something that happened during COVID. You remember there was a very controversial doctor who was saying that she did her own experiments so on. This created a lot of problems, because even at that level, Dr. Surage, where you have that sort of doubt, right, where people, even in doctors, believe in this particular form of medicine. Anyway, you have another call.
Okay.
Good morning. Good night.
Good evening.
Good evening. Interesting program as usual.
Thank you.
Yes. I want to ask a question about high blood pressure tablets. So, like, when you're on the pressure tablets, do you have to take it for the rest of your life?
If you have,
that's what I want to do.
Yeah. Okay.
Thank you.
That's a good question.
That's it, caller.
Okay. Yes.
Okay.
That's it.
All right. Thank you.
All right. Thank you. Thanks for the question. If you have high blood pressure and you're taking medication for it, you will have to take the medication as long as your high blood pressure has continued. If your high blood pressure is because of a genetic makeup that at a certain age you'll have it, then you have to be very careful what you eat and how you weight and your cholesterol, etc., not to aggravate the genetic predisposition. If you have pressure that is because of other things that are reversible, listen very carefully. If the things that cause your pressure, because you were not born with it, it happens. Most people get it because they put on more weight, they eat things that are salty and sugary and get diabetes, the arteries narrow, and things that are reversible. You can now begin to undo this thing by reversing some of the things you can reverse. You can reduce your weight, you can reduce your cholesterol level, you can go on a leaner diet, get fitness, exercise, etc. You may well be able to bring down your pressure to some level where you take less of the medication or none at all. So there was a time they used to think that high blood pressure was once you have it for life. But I think lifestyle has shown to be such an important part of pressure, of the chronic diseases at large, that it is worth not having despair about it, but tackle it and sensibly work with your physician, work with your gym people or whatever. Get fit, get slim, control your weight, control your diet, and you may well reverse some of it.
So let's take a look at the other side of that coin.
Yep.
And you've heard those stories so often. You hear the statement, he stopped taking his medication. And as a result, he had a stroke, a heart attack, that sort of thing.
Oh, I hear that very often.
So do you think then, it's obvious that the medication does play a significant role in keeping the blood pressure at a certain level?
Absolutely, yeah. But so if you have your pressure high and you're controlling it by medication, you should not stop the medication until you control the pressure. So you must be engaged Now, the way to do it is that you would be doing your exercise regime. Diet is a combination of diet, exercise, and medication. If you are leaning towards trying to reverse it, then you take your medication and check your pressure and see if the medication seems to be too much for you, and then you reduce the dosage to see at what point you can control it by these measures. But the recent research is showing that by especially people who have put on weight and they have diabetes, obese, and metabolic syndrome specifically, then there's a chance that you can reverse it.
You have another call.
Hello.
Good night, Dr. Surage.
Good evening. Thank you.
You're welcome. I so agree with you that everything we take, it will treat everybody different. My cousin was really bothering me to start juicing, and I actually got a juicer, and I started juicing. I would put everything: turmeric, ginger, garlic, kale, everything you can think of, oranges, the skin, the pulp, and everything, lemon and all. And that started. I noticed I used to get up on a morning and I was so dizzy. And if I just bend my head, I'm so dizzy. And a nurse told me it's the juicing that does that to me, you know.
Okay.
So what you think about juicing? That is it? Because I think that I understand what you're saying. You're supposed to have a measurement, because I would put a whole heap of stuff in there, and that would get me so dizzy. And then when I stopped it, she told me probably I supposed to at least try twice a week. And then I started drinking it again, and I started feeling dizzy again. So I realized everything supposed to come with measurements. I don't know why it's getting me. They say it's such a healthy thing. I was encouraged to do it, and then I started getting that dizzy effect from it.
But
I'll listen to you on the radio.
You know what you have done there? You have started a research, you know, because what you have done is to take a wide mixture of things, and you do not know what all of them cause. You have done that, but what you have noticed is that it has gotten you dizzy.
Yeah.
And you stopped it, you're not dizzy anymore. You started again, you are dizzy.
Yes.
So you can link the two. You do not know which of the 60 components that you have, which one that causes it. But all you know is that combination causes it.
Now, Dr. Surage, another scenario.
So what do you think I should do then?
One second before you continue.
All right.
Here's the other side of that coin, right? That this is how she reacted. Now, somebody else would have the same drink and wouldn't have that effect.
I would not put a lot of emphasis on that, because generally, physiologically, if you give the body a certain amount of chemical, it reacts a certain way. So the individual differences would play a smaller part, because when you are on the chair for them to give you the injection to kill you, no matter what you do, no matter what body you have, when they give you an injection, you die.
Dr. Surage, that's a good one.
So,
Dr. Surage, what you suggest I do?
What I suggest, I would have answered your question. What I suggest you do is that you can remove a few of them and take it again, remove a few more, take it, and see at what point you're not dizzy.
Because Andre just made it said the right thing, because my cousin that I've been taking it, she doesn't have that effect, and she has been encouraging me to take it.
Exactly.
So everybody reacts differently to certain things.
That is true.
Yeah.
But
Thank you.
Thank you. Okay, thank you for calling, and thanks for that very provoking question. Yes, but I think that the individual interpersonal thing is one issue, and of course, I'm not sure the amount is the same. If they drank the same amount, with the same number of leaves or the same number of things, you know what I mean?
Exactly.
There's a lot of variability that may cause that. But I know physiologically, and we do it because when you were doing physiology for medicine, especially in the older times when I was doing it, that's about 40 years ago, they would take you in the physiology lab, and they would have a dog and give the dog X number of medication, read the pressure, read the temperature, read this, and give you X of another something and read it to show you that this thing has that effect on that body. And no matter which dog you take, the same thing will happen.
So, Surage, before we end, I need to ask you about the human papillomavirus.
HPV.
Yes.
I know you've been waiting
we've
patiently.
heard a lot about this virus and wreaking havoc, especially on women and so on.
Yeah.
Okay, so in the first place, do we know where this virus originated? Did it start with a man, with a woman? Where did this thing come
Well,
from?
human papilloma virus is a virus like all other viruses. And they call it human papilloma because when it attaches on you, it forms a papilloma. And what is a papilloma? A papilloma is a skin condition whereby the virus grows either on a little stalk, so it has almost like one grape on a bunch. So it is attached to the skin by a little stalk, and then it has a growth on it at the end, which can be dangling, or it can be like a wart, large base. You can, if you ever see a wart, the surface looks very rough, and then it's attached on the skin. All these are virus things, and so the human papilloma virus is just another virus, and the virus have many different subtypes, and they have found two of the subtypes have a tendency, if it's been there for a long time, will change into malignancy.
So when you say it's been there, where is there?
Wherever on the skin it's attached.
So I'm asking Dr. Surage, how do we get in contact with this virus?
The contact can happen from several ways. You can, anytime a skin is exposed to a skin and one of the skins have it and the other one may have a bruise or a cut, the virus will attach it.
But we wouldn't know where the person who has it on the skin got it from. We wouldn't know that, right?
No.
Okay,
no,
we don't know that. Right.
And
so,
secondly, usually from somebody else or something else or whatever. And in our human situation, usually 90% of the cancers of the voice box usually is because of a virus. And you can get it from several means. When skin touch skin, usually with oral sex, you can have it. You can have it with anal sex, if one party have it and the other one doesn't. And in the friction up and down movement, you can bruise the skin and allow a condition for the thing to set root on.
Is there anything, Dr. Surage, that we can see? Because if you are with somebody and the person has this virus, is there some kind of symptom that would show itself that you can say, hey?
If it is big and if it is grown to the point where around where during sexual intercourse you may find some bleeding, or if you do your annual pap smear, you may see the skin may have some slight changes on it, or you may see the frank papilloma sticking in there.
But that's the person who has it, right?
Who has it. And sometimes it can be small, you don't see it, but it's there, and because it takes about 1 or 2 years for you to actually...
And again, we don't know where or how the person who has it got it. Yeah, we don't know. Okay, all right. So we don't know, but it's possible we could be with somebody who has this virus.
Usually it's transmitted from one person to the next.
So generally, is it through casual touching or like deep-seated sexual activity?
Yeah, they say it can be transferred if one person has it in one part of your body and that is in contact with somebody else's body that has a crack or a cut or a bruise, it will be passed on.
But in a casual way, just a casual way. For example, I happen to be on a bus and my arm is rubbing against your arm.
It may not happen because the contact time is too short. It mostly in kissing and sexual encounter.
Close contact.
Yeah, because the contact is there, the friction is there, the skin get a little bruised, and it can happen. And oral sex, they also say deep kissing, which is that can cause the transmission. And also, they say that although it is rare, but a mother who has HPV, when they're delivering the baby, when the baby passes, the face passing through the birth canal, it may cause that. Although they say the chances there are much smaller from the research.
As opposed to, for example, HIV, right? That's different?
HIV is much faster.
Okay. So, Dr. Surage, what happens to this person now who is carrying this virus? We're not talking about the person who gets the cervical cancer. The person who has this virus, that could be both male and female, right? Okay. So, eventually, what happens to this person? Will they die as a result of this virus?
No, they would have to be very careless to die from it.
Wow. So you're saying that this person can actually be carrying this thing and not necessarily succumb to it?
Oh, no.
What?
They can have it. It grows slowly. You can see if... In fact, I have one particular person who saw a little papilloma on the palate. And that's so small. When I looked, I didn't see anything. He said, but if you look there, look at the picture. One tiny, about the size of a pinhead. And so it could be a human papillomavirus, it could be another virus. So the idea is to take it out and test it. And if it's a human papillomavirus, watch it. If it, most likely, that's the end of it. You'll not see that again. And so basically, that's how it behaves. You see it, it takes a long time to grow, years. And if you do regular checks, you see the thing, just take it out and you're done.
So Dr. Surage, I'm around someone who has this virus, and I contract the virus from that person, okay? And that person, you said, can go on for years and would not even see any symptoms or anything like that, right? Okay, so now I've contracted this virus. Can I now, okay, pass it on to somebody else while...
Yeah. Well, there's nothing... For example, if you have it in your throat or on your private part and you have unprotected sex, it's possible to pass it to the person.
And by the way, can that passing take place even if I'm not even aware that I have this thing?
Yeah, you aware or not is not the issue. The issue is that the skin that has the thing is rubbing on the skin and bruise it a bit and cause the transfer of that.
And by the way, how long does that process take from the person who I contracted it from and me being able to pass it on to somebody else? How long?
In terms of time, I would say the chance exists if you have if you've had sexual contact with a person, whether it is first time, second time.
Right.
If you're unlucky, first time, maybe nothing happened, maybe. But if you continue,
yes,
sooner or later it will happen. It's a matter of probability.
So for the person who's contracted it, how would you know that they have it now?
If it is somewhere that you can see, like on your penis or somewhere that's visible, then examination.
See what? What do you see?
Well, first of all, you might see the same way you see a wart on your you might see the skin look a little thicker, and that wasn't there compared to the rest of the skin. It looked different. It may not be forming any kind of papilloma yet. It's just a thickened skin, and then you subject it to testing. Your dermatologist will look at it and take a little sample or take it out and send it for testing.
And that's the dangerous part of Dr. Surage, because when we see a little something, it's like, it's no big deal.
But because it grows slowly, you have a chance. If it gets bigger and you see it's not going away, like everything else, and the women are better than men on that. The women, for anything that's not looking normal, they check. And so the men will just put it off. And I have many people like that who have cancer of the larynx, cancer of the voice box. They knew it was getting bad. What they say generally regarding cancer of the voice box, if you have hoarseness in excess of 3 weeks and it's not going away, check it out. That's all. Because cancer of the voice box can be treated very effectively. You can cure it in most time if you pick it up early, before it spread and things. Yeah, but what I wish to say about the the
HPV
is that it enters the body through the skin, where the virus is exposed to the other person's skin, which is bruised and can attach to it. It stays there for a long time. As a matter of fact, you may have it and your body, after 1 or 2 years, actually takes care of it. So many of them, people may have it, the body takes care of it and you never knew.
Mm-hmm.
But if it is becoming a growth, a papilloma, a thickness of the skin, or whatever it is, seek attention and get rid of that.
Because if you don't,
it will get bigger, it will continue growing, and it is not a cancer at that point.
Right. Mm-hmm.
But as it gets bigger, it can be transformed into a cancer, and that's why they call it cancer transforming viruses. There are a few of them like that. Not only papilloma virus, but there are others that cause other things like lymphomas and that kind of thing.
So basically, the advice is to go and always check.
Always check. Something in your skin that don't look right, check it out. And if you put the usual cream, some people will just put local treatment, it didn't work, don't take it for granted. Check what it is.
And the carrier can be both male
or female.
Mm-hmm. Okay.
And that's why they're saying now, although I'm not seeing that discussion being, because we are not really very medically savvy. But for now, we should be talking about vaccinating boys, since the chance of cancer of the larynx occurs with smoking and drinking, etc., and that we have, and we know to a large extent it can be HPV. So I think, and so that thing about this negative thing people have about vaccination, they have to eradicate that, because life is too important for you to gamble it.
Dr. Surage, that's like trying to eradicate what we were talking about earlier. Those natural medicines. Yeah? It's the same.
But very soon I will be talking about the immunization. I'll bring somebody who will talk about it in a little more detail. I think there'll be an immunization week coming up soon.
Okay. Try to dispel some of the myths.
Yeah. The idea is to try to make people live a better life, longer life, a more informed life, and try to not let their life be squandered because of what they believe.
Mm-hmm. Mm-hmm. All right, Dr. Surage.
Well, thank you very much, and good listeners, thank you very much for the contribution you made, and it was very good, and it guided the program to some extent. Thank you very much.
And as always, Dr. Surage, thank you for your service.
No problem at all.
Have yourself a safe night, and God willing, we shall see you next week, Tuesday, same time, 6 p.m. to 7 p.m. for another Doctor in the House with Dr. Leonard Surage, brought to you with the compliments of Dalcan Pharmacy, La Place Salazar, and Tapio Hospital.
At Tapio Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapio Hospital, where the patient safety comes first.
It's delicious.
La Place Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazar, of course. La Place Salazar, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Looking for affordable, reliable healthcare? Visit Dalcan Pharmacy on Coral Street, Castries, where your health comes first. We carry a wide range of over-the-counter and prescription medications, all at unbeatable prices. Plus, enjoy special discounts on prescriptions for kids 12 and under and seniors 60 and over. We offer supplements, body braces, skin care, feminine care, and oral care items, topical creams, and more. plus blood sugar monitors for just 40 EC, 50 test strips for only 50 EC, and blood pressure machines at affordable prices. If what you need is currently out of stock, we're happy to place specialized orders just for you. Need advice? Check out our private counseling room. Visit Dalkan Pharmacy on Coral Street, Castries, opposite the Magistrate Court, or contact 572-5282 or 720-1655 for more information. Dalkan Pharmacy, your health is our mission.
Join Dr. Leonard Surage on REV-UP St. Lucia Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House. This 1-hour discussion call-in program